When I was in medical school, maybe about 25 years ago, the way we learned about pulmonary hypertension was that they said that there is a disease called pulmonary hypertension. We have really nothing to offer except for heart-lung transplantation. And once a person actually received a diagnosis of pulmonary hypertension, they often would have about 2.5 years to live. So that, unless they actually went and got a transplantation. That was the state of the art back then. There were no medications and there was really no management. So it was almost a terminal diagnosis that, for which there was nothing else to be done. Historically, again, it's been a very neglected disease. It used to be very, very specialized physicians, often in the realm of either cardiology or pulmonary specialists. Those are the same specialists that still continue to treat this disease, but I think more and more we're finding persons in both divisions and both types of medicine increasing in the numbers that are interested in treating this disease. We are making more diagnoses of this disease every year, so we think that the significance worldwide is growing, and so I think that we need more practitioners in order to understand and better treat this disease in the future. In this modern era, we actually have a number of FDA-approved drugs now that we can utilize in order to improve the symptoms of this disease and again decrease the or increase the time at which the progression of the disease goes. So we have ways to modify the disease in a very beneficial sense, but again, the medications that we have do not target the molecular origins of the disease, which mean that they neither prevent, regress, or cure the disease. So we really have a long way to go, and there's a huge unmet need in this field in order to understand the disease better and to create new paradigms for treatment. Yeah, certainly there is a problem in terms of late diagnoses. So oftentimes we do diagnose our patients late without having had any therapy going on before then. This is a problem. And so we are hoping that earlier diagnoses might actually improve the way in which this disease progresses. There has been recent evidence to suggest that if we can make a diagnosis earlier rather than later and hit it more aggressively with additional, perhaps even combination therapies up front, this may actually even further prolong the time at which it would take the disease to worsen. And so that's actually great for our patients. Again, we still would not be able to offer a cure in that sense, but I think that that's generally where we think, at least for now, we'd be able to give the best chance for our patients for survival. But again, it is a very nasty disease, and it is in many cases ultimately fatal.